Hi, welcome to today's AMA session. I'm Dr. Adam Carrera with Baptist Eye Surgeons. I'm a comprehensive ophthalmologist who specializes in cataract and refractive surgery. And I'm going to be answering questions today about laser vision correction. So I'll be answering some questions for you. Let's take a look. All right, so the first question is, can you explain what corrective laser eye surgery is? And is it the same thing as LASIK? So yeah, it's a good place to start. So laser vision correction. There are multiple things in the eye that contribute to good vision. One of those is the refractive error. So the cornea, the window on the front of the eye, has some power to it. And depending on the shape and the thickness, it refracts light or bends light. That light then passes through the lens in the eye. That also bends light. And then depending on where that image falls, either in front of the retina, which is the film on the back of the eye, or behind it, it can make you near or farsighted. The people that don't need glasses is actually focused on the retina. So laser vision correction is a surgery that uses lasers primarily that changes the shape of the cornea. So the window in the front of the eye, to change the shape of it, to focus light on the retina if it happens to be focused behind or in front. So that's what laser vision correction generally is. LASIK is a type of laser vision correction. There's also other types of laser vision correction, but when you hear laser vision correction, I think that LASIK is it's primarily what people are referring to. So it's a type. The second question here, how does LASIK work? I've worn glasses since I was in the 6th grade, and my prescription has only gotten worse through the years. LASIK sounds too good to be true. And for some patients, it's an excellent thing. It's one of my favorite surgeries because you can take a patient who's relied on glasses or contact lenses pretty much their entire life, and you can give them independence where they don't have to rely on those things any longer. So what is LASIK? So LASIK, as I mentioned, is a type of laser surgery. Essentially what happens is a flap in the cornea, a paper-thin flap, is created. The eye is numb, the flap is lifted, and that flap can be created with a special knife or a blade, or a laser. That flap is lifted, and then another laser called an excimer laser is used to sculpt or reshape the cornea to adjust its prescription. So different types of refractive error such as astigmatism, myopia or nearsightedness, hyperopia or farsightedness can be corrected with LASIK. Once that shape has been made with the laser, the flap is then placed back down and smoothed out and allowed to seal to the surface of the bed that's been treated. And that's what LASIK is essentially, is reshaping or changing the prescription of the cornea, the window on the front of the eye, in order to give patients an image focus onto the retina. So how do I know if I'm a good candidate for corrective laser eye surgery? So this is a good question. Generally, we will set up an appointment with patients to come in to do a full-on evaluation and take a history, take some measurements to see if they're a good candidate. You're reshaping the contour and the thickness of the cornea, the window on the front of the eye. So there's a couple of things that can immediately let you know if a patient is a good candidate or not. One, the cornea has to be thick enough to handle the changing of the shape, and it has enough tissue to resculpt. So that would be the first thing, and that measurement is done while you come in for an exam. Other things that could make you a good or bad candidate is health of the eye in general. So if you have other issues with the eye that are limiting vision, such as macular degeneration that's severe, or severe glaucoma or severe dry eye, those might inhibit your ability to properly see. There are a lot of things with the eye. It's a complex structure that contribute to good vision. If the eye is healthy, it doesn't have any other issues, then generally LASIK can help with the vision following. Other things, if you have corneal scarring or autoimmune conditions, out of control diabetes that can affect the healing. So those could also limit your ability to be a good candidate for LASIK or laser vision correction. Also, pregnancy actually, and breastfeeding can alter the prescription of your cornea with the eyes, and it's kind of like hitting a moving target. So most surgeons will recommend giving birth and then also weaning off of breastfeeding for 3 to 6 months, at least, so the cornea can stabilize. So we're shooting for a stable target, and the outcome is appreciated by the patient. So my optometrist told me that I'm the perfect candidate for LASIK. The thought of not wearing glasses or contact lenses sounds great, but LASIK is much more expensive, immediate investment. Do you guys offer payment plans or any other financing options? Yeah, so the LASIK is expensive. It can be expensive. Glasses and contact lenses are also expensive. If you add up, the cost of a pair of glasses at an optical shop and multiply that by a couple of years, it doesn't take long until you start getting in the range of what LASIK is in and of itself. So in the long run, I feel like LASIK is a good investment, but it can be a lot to swallow in the beginnings. Our laser center, we have the girls upstairs that'd be happy to talk with anyone about payments that we accept. I believe that we do a care credit as well, which is a type of payment plan that you can get financed. So there are options. It doesn't necessarily have to be paid all up in the beginning. Calling our laser vision center and talking with the girls upstairs will be helpful in knowing what your options are. Another patient says, I have severe astigmatism. Around 10 years ago, I checked to see if I was a candidate for LASIK, and I wasn't. Has there been anything that has changed that can make me an eligible candidate now? Yeah, so LASIK primarily uses a laser, and we use lots of devices, diagnostic tools for the pre-op screening for your visit when we're trying to decide if you're a candidate or not. And that technology is always expanding and growing. So the lasers are becoming more efficient. They're getting to where they can treat larger amounts without removing as much tissue from the cornea. The diagnostic tools are doing a better job of screening patients that might have issues following surgery. Also picking out patients that would have good results. So just being more sensitive and specific. So yeah, that technology has changed in the last 10 years. We do offer free screenings to see if you would qualify. So you have nothing to lose. I think it's worth at least scheduling an appointment, coming in and being checked out. It could be that you're still not a great candidate. It could be that things have changed and you are. So you have nothing to lose. I would highly recommend coming in and having an evaluation. Another patient says, how long does LASIK surgery take? So this is another great thing about LASIK is that in terms of surgery, it doesn't take very long. Generally, I like to tell patients to expect about 15 minutes per eye. You're creating the flap, you're doing the treatment. You'll find that though the creation of the flap, we use a laser to create the flap here. It seems to be very accurate and safe. Also, we have the laser. There's two separate lasers. There's another laser, the excimer laser, that does the treatment. The lasers themselves, total treatment time is less than 5 minutes. Most of this is positioning and getting things ready, cleaning around the eye, numbing the eye, all of that thing. So the actual time of being actually under the laser is very minimal and typically well tolerated. Another patient says, so the thought of surgery makes me really nervous, but eye surgery doesn't sound fun at all. Is there anything you all do to help patients feel more comfortable about having surgery? So yes, it's understandable. The eye is a very sensitive organ, and people are very touchy about people around their eyes. So that's to be expected. It's your body's natural response to protect what I feel is the most important organ of the body. So we sometimes will give medications prior to the LASIK or other laser vision correction. procedures to help the patients calm down and relax. The assistants upstairs are very knowledgeable. They've been doing this a long time. They have an excellent bedside manner, do a great job of putting patients at ease. I do my best to keep patients at ease. I think the biggest thing that causes anxiety around laser vision correction is the unknown of having someone around it. So I think clear communication about expectations, and I have that discussion in the clinic before anything ever even gets scheduled, so the patients know what to expect. Talk with them through the operation so they know what's happening and what's occurring. Most patients do very well. Someone else asked, does LASIK surgery hurt? That's a great question. So it typically does not hurt. We use numbing medication on the eye with drops to make them comfortable. A creation of the flap, I will say that the creation of the flap, the device, the laser that does that, there's a suction ring that holds the eye in place so everything's done in a safe manner, an accurate manner. That suction ring can sometimes feel uncomfortable. There's pressure. It's like someone has a finger that's pressing hard on or pressing firmly on the eye. It doesn't cause pain per se, but is a pressure-like sensation. Vision may blur during that. And most patients say that's the worst of it. Thankfully, that ring is on for 20-30 seconds before it's removed. The actual treatment and reshaping of the cornea, generally no pain whatsoever. There's a flashing light, fixation light the patient looks at, and they're there comfortably while that treatment is occurring for a couple of minutes. Most of the discomfort is actually following the surgery. So the creation of the flap can essentially make the eye feel really scratchy and dry, and it feels like that usually for the first day or two. We like to have patients go home and take a big long nap after the surgery, and by the time they wake up, they feel much better. And usually we deal with some dryness or scratchiness for the first few days, but that generally resolves. Let's see. Okay. Patient here says, I would love to get LASIK, but someone once told me that you should wait until after you have kids because pregnancy hormones can change your eyesight. Is that true? So I kind of alluded to this earlier, and I would agree with that. If you are pregnant or nursing, I'd recommend holding off due to the hormonal changes there and fluid shifts. There are changes in your prescription throughout pregnancy and nursing, and it would be like hitting a moving target. So most surgeons will recommend that you're done with that before having an evaluation and planning for surgery, so you're happy with the results. Some surgeons will recommend being completely done with childbearing before moving forward, and I think that's honestly a conversation that you should have with your surgeon. Some people aren't sure what they want to do as far as children and how that fits into their life. So I wouldn't necessarily wait until you're completely done with children before you do move forward, but I would at least recommend not being pregnant and not breastfeeding while we're talking about moving forward with surgery. Another patient here says, does LASIK eventually wear off? If I get it now, will I have to get it again in the future? Generally, no. Most patients will remain stable with their treatment. It doesn't regress in most cases. There are some cases where after treatment there will be some mild regression, but that's the exception rather than the rule. Most of the time, patients get many years of enjoyment after their LASIK or laser vision correction, and they make it up until their 40s or even early 50s. At that time, there are actually aging changes on the inside of the eye that's occurring with your natural lens, and presbyopia is another name for what occurs in some patients where they become, or it becomes difficult for them to see up close and they need reading glasses. LASIK doesn't fix that. So in some cases, some patients will, at some point in their life, all patients will get to that point where they will need reading glasses, especially if they're set for distance with the laser vision correction. So that might be what you're referring to. It's generally not the LASIK that's worn off, it's the other life changes in the eye that laser vision correction doesn't fix. Most people do not need retreatment. Last question here. My friend got LASIK a few years ago, but she still has to wear glasses while she drives at night. Does everyone still wear glasses for things like reading or driving after LASIK? Generally, no. That's not typical, but it happens. And I think it's important to talk with your surgeon about expectations for laser vision correction. Fortunately, since its use in the early 90s, laser vision correction has helped many people decrease their dependence on glasses and contact lenses, and most find that they don't have to rely on glasses or contacts for most activities. Some patients don't rely on them at all. So everyone's experience is different. It's good to have realistic expectations. Most patients are able to drive at night, are able to read until they get into presbyopia years that we talked about without any help. Some patients do have some light sensitivity, some decreased contrast, decreased night vision that does require glasses following laser vision correction. And certain people may be more prone to that. Talking with your surgeon would let you know expectations and what you should expect as far as your outcome. Also talk about your goals, if it's to fully get out of glasses or just rely on those less, and what activities you would like to get out of those mostly. That would help patients understand what they need to do as far as planning for laser vision correction. So I believe that is the last of the questions. Thank you again for joining me. I'm Dr. Adam Carrera again. Look out for more Ask Me Anything sessions. Send in more questions if you have, and I'll try to reach out through our Facebook page or other social media to answer those questions. And feel free to schedule an appointment with us. We have free consultations. We can check and see if laser vision correction is a good option for you to help reduce your dependence on glasses and contact lenses. Have a great day. Thank you so much.